This is about the birth control and that is the contraception. It is advances in understanding of reproductive physiology, genetics, molecular biology, and the medical biotechnology have been enable humans to intervene in their own reproduction. The couples who desire to avoid unwanted pregnancy often use some form of the birth control or contraception. A wide variety of birth control methods and contraceptive devices are commercially available, and it is a use of contraception helps couple plan their family by controlling the number of children and also the time between their birth, and it permits women to plan their careers and couples to maintain a higher standard of living than would be possible with large families. And it is availability of safe and effective contraception together with education about its correct use can prevent many unwanted pregnancies. From a global point of view, the contraception can restrict the growth of the ever expanding human populations. So the main objective of this contraception and birth control is review our reproductive systems and to learn about the various methods of contraception or birth control to prevent pregnancy and sexual transmission diseases. So this birth control is now it is a very technological method is available in the market medicinally. So you can see this is a person with a vagina, the fallopian tube, ovaries, the uterus, cervix, and the vagina. The reproductive system person with a vagina, the fallopian tubes is the most important. They are in intercourse with their penis in the vagina, and it forms there the with the help of their birth control. So you can see these ovaries and the fallopian tubes, see the menstrual cycle they can have been utilized. So this is the reproductive system with person with a penis, and that is the urethra, penis, testes or testicles, and the scrotum. So mainly this is a male reproductive systems for utilize their intercourse and the reproduction for their fertilization. So you can see this reproductive system person with the penis, that the bladder, seminal vesicles, and the prostate gland is important for their urethra, and this epididymis and the testis or testis, the scrotum, the epididymis, they are stored their sperms in their penis. This STI and the pregnancy prevention, the abstinence, hormonal methods, and the non-hormonal methods. So now it is what is the methods for this abstinence. Now it is this abstinence is a one of the abstinence for their methods in the pregnancy for their prevention, and it is simplest form of the birth control, that is known as the abstinence. If two people don't have sex, sperm can't fertilize an egg and there is no possibility of pregnancy. Other forms of birth control depend on barriers that prevent the sperm from reaching the egg, and such as the example of these different types of the medical techniques. So this what is abstinence? It is avoiding vaginal intercourse, penis or to vagina sex, and avoiding oral mouth to penis or vagina sex, and anal intercourse, penis or anus sex, and avoiding genital contact, any type of direct touching of the partner penis or the vagina. And this abstaining is not necessary forever, and it is not only for virgins. It is only about 100% effective method against STIs. that STIs is nothing but this is a the sexual transmitted diseases or the sexually transmitted infection, that is STI. And this is only they are do not have vaginal, anal, oral sex or skin to skin contact. What are alternative ways that a person who is abstinent can be intimate with a partner? For this birth control, there is another one phenomena is that is the hormonal methods of the birth control is. So you can say this pill or pill, a hormonal method that contains the estrogen and progesterone or progesterone only, and it prevent really the mature egg, thickens cervical mucus, changes in the lining of the uterus, and typical effectiveness rate is about 91%. So you can see this type of the pills can utilize for their birth control, but it is very dangerous to their cervix and the ova because of this tablets is a higher infection with their ovary. So this transdermal patch, a patch that releases hormones through the skin, and this thin, smooth and baked patch prevent the release of a mature egg and thickens cervical mucus and changes the lining of the uterus, and typical effectiveness rate is about 91%. The vagina ring is it is a soft and flexible ring inserted into vagina, and the ring slowly releases hormones while in the vagina for 3 weeks. They prevent the release of a mature egg and thickens cervical mucus. It changes the lining of the uterus. The typical effectiveness rate is about the 91%. So you can see this is your rings can utilize for birth control. Then injectable contraceptives, they are administered every 12 to 13 weeks. Prevent the release of a mature egg, thicken cervical mucus, changes the lining of the uterus, and the typical effectiveness rate is about 94%. So there is a 150 mg per ml, the Depo-Provera contraceptive injection is available in the market. Then the IUC, that is intrauterine contraception, that is C-shaped device inserted in the uterus by a doctor or nurse practitioner, and the copper uterine device, no hormones, Lenovo gestral releasing intrauterine system, and typical effectiveness rate is about 99%. So this type of the copper T can utilize for their birth control. So these hormonal methods to birth control is side effects that may occur during the first few months on hormonal contraception include irregular bleeding, spotting, nausea, mood swing, bloating, breast tenderness, and headaches. And the emergency contraception can be taken up to 5 days after intercourse, and the sooner it is taken, the better it works, delays or prevent the release of the egg, may prevent implementation of a fertilized egg, and it is effective about 95% if taken within 24 hours after intercourse, and the 85% effective it takes 25 to 48 hours after intercourse, and 58% effective if taken 49 to 72 hours after intercourse. So this is about the birth control and the hormonal control of their birth control, and the remaining methods of these barrier methods we can see in next lecture.